Leukemia is a serious and complex form of cancer that affects the blood and bone marrow, the soft, spongy tissue inside bones where blood cells are produced. It begins when abnormal white blood cells are produced uncontrollably, disrupting the normal balance of blood cells in the body. These abnormal cells crowd out healthy ones, leading to a range of symptoms and complications that can affect various organs and systems. Definition and overview. Leukemia is a type of hematologic, blood, cancer that primarily targets white blood cells, leukocytes, which play a crucial role in the body's immune system. Under normal conditions, the bone marrow produces blood cells in a controlled manner: red blood cells for oxygen transport, platelets for clotting, and white blood cells to fight infections. However, in leukemia, the bone marrow begins to produce large numbers of immature or abnormal white cells that do not function properly. These cells multiply rapidly, crowding out healthy cells and impairing the body's ability to fight infections, control bleeding, and carry oxygen. Types of leukemia. Leukemia is classified based on how fast it develops and which type of blood cell it affects. There are four main types of leukemia. Acute lymphoblastic leukemia, ALL. This type develops rapidly and affects lymphoid cells, a type of white blood cell responsible for the immune response. ALL is most common in children, though it can also occur in adults. Acute myeloid leukemia, AML. AML progresses quickly and affects the myeloid cells, which normally develop into red blood cells, white blood cells, and platelets. It is more common in adults but can occur at any age. Chronic lymphocytic leukemia, CLL. CLL develops slowly and primarily affects adults, especially those over 55. The cancer cells often function partially, allowing some normal immune activity for a time before symptoms appear. Chronic myeloid leukemia, CML. CML progresses more slowly than acute forms and affects the myeloid cells. It typically develops in middle-aged and older adults. A genetic abnormality known as the Philadelphia chromosome is linked to CML. Causes and risk factors. The exact cause of leukemia is not fully understood, but several risk factors are known to increase the likelihood of developing it. Genetic disorders, conditions such as Down syndrome, Li-Fraumeni syndrome, or Fanconi anemia can increase risk. Radiation exposure, high levels of ionizing radiation, such as from atomic bomb exposure or radiation therapy, can damage DNA in blood-forming cells. Chemical exposure, benzene, a chemical used in some industries, is linked to leukemia. Previous chemotherapy, patients treated for other cancers may develop secondary leukemia due to DNA damage from chemotherapy drugs. Family history, having close relatives with leukemia slightly increases risk. Smoking, cigarette smoke contains carcinogenic substances that can contribute to DNA mutations leading to leukemia. Symptoms of leukemia. Symptoms vary depending on the type of leukemia and how quickly it progresses, but common signs include persistent fatigue or weakness due to anemia, frequent infections, as abnormal white blood cells cannot fight pathogens effectively, easy bruising or bleeding, such as nosebleeds, bleeding gums, or tiny red spots on the skin, petechiae, fever and night sweats, bone and joint pain due to overcrowding of bone marrow, swollen lymph nodes, spleen, or liver, unexplained weight loss or loss of appetite. In chronic types, symptoms may develop gradually, while acute types often present suddenly and progress rapidly. Diagnosis. Diagnosis of leukemia involves several medical tests. Blood tests, a complete blood count, CBC, often shows abnormal numbers of white or red blood cells and platelets. Bone marrow biopsy, a sample from the hip bone is examined under a microscope to identify cancerous cells. Genetic and molecular testing detects chromosomal abnormalities or mutations such as the Philadelphia chromosome. Imaging tests, CT scans, MRIs, or X-rays may be used to detect organ involvement. Treatment options. Leukemia treatment depends on the type, stage, and patient's health condition. Common treatments include chemotherapy, the main treatment that uses drugs to destroy cancer cells. Targeted therapy, drugs that specifically attack genetic or molecular abnormalities in leukemia cells. Radiation therapy, used to destroy cancer cells or relieve pain in certain areas. Stem cell, bone marrow, transplant, replaces diseased bone marrow with healthy stem cells to restore normal blood cell production. Immunotherapy, strengthens the immune system to recognize and destroy cancer cells. Supportive care such as antibiotics, blood transfusions, and nutritional support is also important during treatment. Prognosis and prevention. The prognosis of leukemia varies widely. Acute leukemias require immediate treatment but can often be cured, especially in children with all. Chronic leukemias may be managed for many years with proper therapy. Early detection and medical advancements have greatly improved survival rates. Although leukemia cannot always be prevented, reducing risk factors such as avoiding smoking, limiting chemical exposure, and maintaining a healthy lifestyle can lower the likelihood of developing it. Conclusion. Leukemia remains one of the most challenging forms of cancer, but modern medicine has made significant progress in its understanding and treatment. Early diagnosis, personalized therapy, and supportive care have transformed leukemia from a once uniformly fatal disease into one with a high potential for remission and long-term survival. Ongoing research continues to offer hope for a complete cure in the future.